Hi, I'm Nina, one of the nurses here at Cynthia Gregg MD, Face and Body Specialist, here with my colleagues Melissa and Andrea. And today we're going to spend some time talking with you about the consultation process with us, as well as some before and after care and the reasons behind that. So I'm going to start with talking about the consult. It typically begins with a phone call to the office where you would meet with Danielle, our patient care coordinator. She would help find out what you're looking to accomplish and schedule the appropriate amount of time for us. It's very helpful if we know if you're looking to just meet with us and get information, probably a 30-minute consult for that, or if you're looking to meet us, get your plan and go ahead and start with the treatment. So that's a key component. We would love it if you would have all of your paperwork done. We'd prefer it through the portal, but if not, if you could arrive early to the office so that we can have your medical history. We really try to focus the time we have with you to be actually treating you and educating you. Once you're here, we usually get a baseline set of photos so that we know where we're starting. They're great. Once we've done any treatments on you, we usually have you come back about 2 weeks so that we can take that second set of photos and pull them up and show them the before and afters together. If there's a treatment that you would like numbing cream for, particularly when we do some of the fillers like the lips, we would recommend that you come to our office probably about 15-20 minutes early to get that applied. We really want our time to be treating you and educating you. One of the things I always do is a lot of patient education, and I know you guys do that as well. Everybody thinks that they're the only ones whose lips thin out or the cheeks fall down, and it's all a normal part of the aging process. The other thing that I do is find out your timeline. If you're coming in and you've got a big event in 4 weeks, we might do multiple syringes of filler. Some people just want to kind of dip their toe in the water and start with Botox. So I think knowing why you're here and what your time frame is, your budget we take into account. So all those things help us to really meet your expectations. Any other things, ladies?
I think you covered it really well. Yeah, thank you. Thank you. I think at this point it would be appropriate for us to talk about what the patient should do before they arrive for that first appointment, right? So that it can be as seamless as possible. So we do like to ask our patients a couple of weeks beforehand if they could refrain from any anti-inflammatory medications if it's appropriate. Of course, sometimes that would mean checking with your physician to make sure that it's okay to come off some of those medications, as well as any over-the-counter supplements. Some over-the-counter supplements actually are blood thinning and can increase bruising for that appointment. So that is a very important consideration, as well as we like to avoid any dental work 2 weeks before and 2 weeks after any filler injection appointment. And that's all patient safety to minimize the risk of any possibility of infection. If you have a history of cold sores, we like you to get on a prescription, an antiviral prescription that we will send in for you. And that's, again, to prevent an outbreak of cold sores. I like to ask my clients if it's at all possible, if they come in for their appointment, to come in with as minimal makeup on as possible and to avoid putting makeup on the day of the injection. Do you agree with any of those things?
Yes.
Okay. Did I leave anything out? Was there anything else?
I don't know if you clarified about the dental work, but oftentimes people think that teeth cleaning's okay as long as they're not getting a root canal. But anytime anybody is traumatizing the gums, we don't want any transient bacteria to get in there. We consider these fillers implants, and knock on wood, we've got a 0% infection rate and want to keep it that way. So it's always for your safety.
You're right, because a lot of times patients will say, well, I only had a cleaning. And honestly, a cleaning's probably the worst thing because you're really stirring up a lot of germs in the mouth. And we want to be pretty fastidious, especially when we're doing filler injections. Not so much with Botox, not at all with Botox actually, but with filler we're very careful about cleaning the skin and having you well prepared for your procedure so that we can avoid any of those complications post-procedure. We do like to avoid vaccines 2 weeks before or 2 weeks after any filler appointment. And the reason being, there has been some reports of some nodules post-procedure with patients that have had a vaccine. I'm sure you've heard on the news that there can be some swelling and there can be some nodules, and we have thankfully not had any of those issues because we do stand firm on that 2 weeks before and 2 weeks after your filler appointment, no vaccines.
I think also it should be noted any nodules nationally that they've reported were remedied with oral antihistamines. So if one did in theory swell from having a vaccine, we still are conservative, staying within the 2-week window. It is remedied with oral antihistamine, so and not a permanent nodule.
So now I'm going to hand it over to Melissa, and she's going to talk a little bit about post-treatment instructions.
So for the post-care instructions, we're going to have you refrain from doing any cardio for 24 hours and not lie down for 4. And the reason is with Botox, research has shown that if you lie down after injection, it could migrate into a muscle group we don't want it in. And so we're conservative and we'll have you refrain from lying down for 4 hours after injection. With dermal filler and Botox both, just refraining from cardio for 24 hours will minimize soft tissue swelling, and if one were to bruise, it will minimize the chances of excessive bruising. The other thing is we're going to have you refrain before and after for getting laser or chemical peels. We want to make sure that we minimize trauma before and after the procedure. Additionally, we're going to have you minimize the use of makeup. You're going to not be wearing a lot of makeup after the procedure, and we'll go over a customized post-procedure list when you're in the room and after your treatment. We like to make sure that patients have education, so we'll actually give you a pre and post sheet when you're in for consult that kind of recaps everything so you don't have to remember everything in this video. But again, post-care, you're going to want to make sure that you take it easy, you listen to your body. You can take Arnica, which is an oral supplement that can help with soft tissue swelling or bruising if you were going to bruise. That's widely available now at Walgreens, Whole Foods. We carry it here in office. The other thing is called Enhance. It's a product we have here by Alastin, and Enhance has been shown to minimize soft tissue swelling and bruising. And that's also another tool that we could recommend for post-dermal fillers. Do you girls agree with that?
Absolutely.
I do.
The other thing that I found helpful, because we all inject a lot of lips, is I always tell clients don't love them or hate them for 2 weeks. Mm-hmm. If you love them, the swelling will go down. If you hate them, the swelling will go down.
True.
And we do all keep Claritin in our room, so if any kind of antihistamine kind of helps that along. Maybe the other thing, too, is sometimes I've had clients that are going to a black tie event that day. Probably not a good idea. We're all gentle, soft injectors, but you can bruise. So try to plan no big events for that first week out. I think that's less stress for you guys and less for us.
True. And again, to Melissa's point about minimizing makeup, we all kind of get a little nervous about that. I know there's a lot of clients that are like, oh, I have to not wear makeup just for a day. You can actually wear a tinted moisturizer, and I tell my clients if they absolutely need something on their lips, just to make sure it's a new product, like a new Aquaphor that comes out of a little foil packet. Again, it's all just to avoid infection. So if you're using your old lipstick, that actually is pretty dirty. So that's what I tell my clients, because I just don't want people to feel like, oh, I can't go out naked. Because there is very little downtime, especially if you don't bruise. So you can go out and, do a normal day. And if you need a little tinted moisturizer and a little something on your lips for moisture, as long as we're using clean products, then I feel like that's okay.
I agree. Yeah, that's a good point. And I think to carry off of that, with the love them or hate them, with dermal fillers, there is going to be a certain amount of soft tissue swelling in general.
Absolutely.
So patients are going to have to wait 2 weeks to fully assess if we add more. We're conservative injectors, so you can always add. We're not in the game where we take out. We would rather add than take away. So let your body heal, let it settle. We can always do a stage 2. But again, the 2-week mark is really where we're going to appreciate the full results.
Good.
I think that wraps it up for
I
this
think it
video.
does. I think
Yeah, do. We look forward to having you in the office with us.
Yeah. Okay, so, well, thank you all for joining us today for the Patient Appreciation Day. You can call to set up your consultation to see if you're an appropriate candidate for our treatments that we have listed on our website. Also, you want to tune into our YouTube channel or subscribe to see the latest updates and what we're planning in the office. We really look forward to seeing you in the office, and thank you so much for joining us today.